Hello, please, we can proceed, Laura. Please, let's get started.
All right, thank you, Ma. So, happy International Women's Day to each and every one of us once more, and welcome to this great meeting. I'm so excited to be here. Like I said, I'm going to be emceeing, and with me, I have my co-host with me, Miss King. So, without further waste of time, I would like each and every one of us to give it up for Miss Kim as she takes the mic so she can begin with the program. Miss Kim, over to you.
Thank, thank you very much, Ms. Ballon Laura. As Ms. Ballon Laura Eya said, I am Kimbi Mishla and I will be her colleague for today's webinar. Happy International Women's Day once again to everyone. And as you know, our theme for this session is informed rights, informed choices, and informed actions. Since we are already late into the program, I'm not going to give like a program outline, but I'll try to indicate before the next speaker or a next person has to present. Good afternoon, good morning, good evening, from depending on where you're coming from again. And welcome to this special International Women's Day webinar. My name is Kimbi Mishla, and I'm truly honored to serve you as one of your hosts for today's event. Today, we gather not only to celebrate Women's Day, but to empower women with more knowledge. Over the next 2 hours, we will hear from incredible speakers who will guide us through three powerful pillars. That is understanding women's rights, making informed healthcare choices, and taking informed actions and advocating for themselves. I encourage everyone to stay engaged, take notes, and also share your thoughts in the chat box as the speaker is present, as our speakers are presenting. Once again, welcome and happy International Women's Day. Please, I would love to ask Madam Chen Root to please lead us in a short opening prayer. Thank you.
Let us pray. Our Heavenly Father in heaven, we thank you for this beautiful day. We thank you for making us be part of this wonderful day, the Women's Day. We pray, oh Lord, that as we've begun this meeting, may you be with us and may you make this meeting be a success. Lead us, oh Lord. Touch our hearts, oh Lord, as we touch other hearts, O King of Glory. Be with us as we begin till the end in Jesus' name. Amen.
Amen. Thank you very much for the opening prayer. Before we proceed with the rest of our program, it is very important for us to hear from the visionary behind this initiative. At this moment, I would like to respectfully invite the founder of the Inform Mothers to give us a brief welcome address. And also, please, while she is giving her opening speech, I would also love to ask the participants to please comment where they are joining from and also share what women's empowerment means to them in the chat box. Please, let's engage in the chat box while we welcome our founder.
Thank you, Mishla, for this opportunity. Good afternoon to everyone. Happy International Women's Day. I am Success Maureen, the founder of the Inform Mothers. So before we begin today's session, I want us to pause for a moment and ask a simple question. What does International Women's Day really mean? We always hear about Women's Day, Women's Day. Have you ever thought about what it means or where it originated from? Why do we celebrate Women's Day? So I want us to have this little reflection before we get into this session. So for many people today, Women's Day is a day of celebration. Women's Day is a day to wear beautiful outfits, do social media posts and write inspiring quotes about women. But the truth is that International Women's Day was not born out of celebration. Yes, it was not born out of celebration. It was born out of resistance. If you want to trace it back to history, you will notice that more than a century ago, women around the world gathered and began raising their voices against injustice. So this is how Women's Day began. Women were tired of the inequalities, tired of the injustice. So they said, enough is enough. We cannot go on like this. Enough is enough. So they gathered around the world, raising their voices against the injustice happening in their workplace, in their communities, and whatnot. They protested for unsafe working conditions, and also they protested for unsafe working conditions, unfair wages, that's unfair payment, and a system that denied them the right to vote, the right to lead, and even the right to be heard. So women marched, women organized, women demanded change. That is how International Women's Day came about. And from that movement came a global recognition. So it's because of the women who stood up against injustice many years ago that today we can celebrate International Women's Day. So I want us to have this at the back of our mind, and I don't want us to be celebrating the day blindly or celebrating the day as a trend, because it is not a trend. Women's Day is more than celebration. It's in what change do we want to see as women? That's the purpose of this day. Today, we see many women, they are still denied, despite all of these protests from many years ago. Today, we still see many women denied of one very powerful tool that shapes every decision they make, and that is information. We see that in healthcare, lack of information continues to cost women their dignity, their confidence, and sometimes it can even cost them their lives. Many women do not know that many women today do not know their rights in healthcare. Many women do not know the options which are available to them. Many women are forced every day to make life-changing decisions without the knowledge they need, especially when it comes to healthcare. And that is exactly why the informed mothers exist. We exist to bridge this gap. We exist to bridge the knowledge gap which exists in our society today among women. Because we believe that when a woman is informed, she becomes empowered. An informed woman is an empowered woman. And if a woman is empowered, her community is empowered as well. Because you already know the woman holds a very important position in the community. The woman has so many important roles which she does in the community that without her, the communities will not thrive as they should be. So women's health information is very important. When a woman understands her rights, she can speak up. She can speak up for herself. She can speak up for those around her. She can speak up for her children. She can speak up for her family. So that's the power that information holds in a woman's life. And when women begin to make informed choices, the entire communities become healthier and strong. So today is not just another event. This is not just another event which is being held on Women's Day. This is for every woman who wants to take charge of her health journey. This is for every woman who is tired of being shut down when she expresses her concerns in healthcare settings. This is for every woman who is tired of her voice being depressed. This is for every woman who is saying enough is enough. This is for every woman who wants to find her voice and stand up for herself. So this space is for learning, unlearning, and most importantly, this space is a space for growth. So our goal for today is simple. Our goal for this session is simple. It's for every woman who joins us today to leave this conversation a little more informed, a little more confident, a little more empowered to take action in her own life. That's our goal for today. And that is why the Informed Mothers is hosting this session. Informed rights, informed choices, informed action. welcome to the conversation. And I'm so happy that you made this decision to be here today on a day like this where people have different places to be. You chose to be here. Thank you. And I hope you enjoy the session and listen attentively, engage in the chat. If you have any questions, you write them in the chat and we are going to attend to you. I hope you have a wonderful session and I hope you leave here an empowered woman. Thank you.
Oh,
Thank
wow.
you very much. Thank you very much, Madam Success. Thank you for those inspiring words. And we've learned something today that Women's Day is not just about celebrating, but it's about fighting for against injustice and inequality. And as Madam Success said, our goal for today is at least one participant should leave with a little more knowledge, a little more confidence should be added to your confidence that you already have so you can make better choices and choose better actions to do. So thank you very much, madam. And we will now move into the first session of our webinar, which focuses on informed rights. I am pleased to introduce our first speaker for today, Madam Quine Rood. Madam Quine Rood is a 22-year-old land surveyor with a deep passion for community service, mental health advocacy, and empowering people through words and support. Today, she'll give us more insights on about women's health rights, why women are unaware of these rights, and also what respectful women-centered care should look like. Please join me in welcoming Madam Quine Rood. Madam Quine Rood. So, as we good afternoon.
Good afternoon.
Good afternoon.
Hello.
Yes, hello. Good afternoon.
Good afternoon, everyone, and happy International Women's Day to everyone, to all our beautiful ladies in Cameroon, Nigeria, and other countries. I welcome you all here once more. Every woman deserves care, and violations happen every day because we are unaware of our rights. I am Kwine Ruth. As Ms. Misha Riley said, I am a land surveyor by age 22 and a passionate being for community health awareness. I will be presenting on informed rights. And to begin with, I would like you to know them, claim them, live them as you journey with me into the informed rights of our women. As I earlier said, every woman deserves care. This care ensures safety, her respect, and dignified health care. Ignorance, they say, is a crime because when you're ignorant, you don't even know what you're missing out there. You don't even know your left and your right, and there is no justice for you. There is no justice for you. Generally, generally, we have women's rights, and also we also have the women's health rights. I'll briefly just state some women's rights, which are equality, both in both the way we treat the men, same way we have to treat the women. Access to quality education and resources. We shouldn't limit education only for the men. We have quality health and safety. They have the right to decision making and also safety and protection, as well as every other human being on earth. Please, slide 4. Going too far. To continue, what are women's health rights? We are more concerned about the health of women, and without a proper health, without good health, a woman won't be able to act. She won't be able to stand up for herself and the justice in which she seeks. So, some of the points in which we have laid down as women's health rights include a safe and quality medical care. She's open to it and it's her right to undergo such. Dignity during treatment. Her care, she needs that care. She needs that consent from from our health officials to take care of her and to assess her properly. informed decision making. She has the right to say yes or no. And she has to know why you are doing or carrying out something on her or carrying out a procedure on her. She has to know such. Weeks back, I've forgotten that word. I think it should be erysiotomy. Erysiotomy. I don't know if you've ever heard of the word, which I learned that it's a procedure in which a woman is cut before she pushes out her child when giving birth. That's a procedure I never episiotomy. Thank you, Madam Success. Thank you very much. I've never known about that word or something like that. So if a woman now goes in and for labor and the midwife tells her that, hey, mommy, we are to do this. And while telling her, you ought to explain to her that this is what this procedure will do to you. If in case you don't know what that procedure means, the pregnant lady can likely say no, but that's because she does not know. She doesn't even know her rights in that hospital on that bed. And she's also fighting to save her child. So with the health official who is out there to explain everything to her, it makes her free, yes or no. We also have freedom from abuse in health facilities and also privacy to their health information. I can't go and welcoming the next time I'm hearing the nurses discussing that, hey, a lady came here last time and she had such and such. Means my information, which I held in privacy with my doctor, fled out, which is not good. Yes. Our women also have the right to ask questions free of mind. Even if you do not go to school and you do not have the privilege to explore the rights of education, you can still ask. You can still ask about everything. So this all protects a woman's dignity and safety, especially during vulnerable moments like pregnancy, especially and childbirth, especially that episiotomy, yes, and postpartum, family planning, and even when she's undergoing her treatment. Core health rights every woman has and should not like just let them pass like that. I should not let them pass like that. Informed consent before any procedure. She has to know all that about the procedures that has to happen on her, and the clear information about her health in understandable language. Has the right decision making, as I earlier said, by accepting or refusing treatment, even though in this point, I cannot really say you should refuse a treatment in which your doctor has really prescribed for you, except you have an allergy for it. Yes, except you have an allergy for it. Quality safe care, emotional support during labor. Even if not during labor, our women need emotional support. Even if not from the men we love, not from the men we have in our lives, I believe we can create our own emotional space, our own emotional health, our own emotional well-being without relying on other people. I cannot really give us the ways, but I believe that everyone is happy when he or she is mentally well, emotionally well, and not having, they call it, for example, mood swings. For example, mood swings are not really going to that, which can actually affect what she's doing out there. So how you feel, how you feel is going to affect what you are going to be doing out there. In case I was angry and all that, I won't be presenting this to you well, and I believe I am too well. So to continue, why many women don't know their health rights. Aside the health rights, there are many women who don't even know their rights. Yeah, they don't know their rights. This is like six. They don't know their rights. Some of them they don't just want to learn about their rights or to know their rights. They are just there. They are just there. And there's a popular one, they say, what a man can do, a woman can do. I forbid that one. For me, I cannot do it. I forbid it. I forbid that one. So that's not even a right to, or something that can be based on. So why women don't know their rights is low literacy, low low interactions in the research space, no communication with women empowerment, women counselors. Some of them just be like, the women are just like, no, I can do it by myself, I can do it, yeah, I can do it. They don't go out there not to like seek for questions, answers, seek for discussions that relate to certain matters that are bothering them. They don't. And there's another one, cultural belief. Some of us are just based on culture that anything, with the fact that our parents, for example, there is a genital mutilation. If my grandmother did it, my great grandmother did, they were doing it to them. And today I come out today and I am still doing, and then then a health official now comes and tell me that you are not supposed to do this because it's going to affect your health. It's going to open you to various diseases down there. I, as the one that my family has been doing it, I never knew that. I never knew about it. In which it will be a great challenge, a great the head official needs to work, and I myself also need to work on myself on cancelling out that belief in me to ensure that I don't let my future children, my generations, to be part of those who were mutilated genitally. Yes. We also have fear of healthcare workers. As our healthcare workers, and the moment you see them, their faces, they are just squeezing their face anyhow. And the way they interact with the patients, it can make the patient to either open up or to just close up. You will meet someone, like for example, let me say a nurse in the hospital, I enter, and you're just tying your face anyhow for me. Or let me say not even for me, but I just tie your face. I won't feel that freedom to open up. I won't. But the moment I start a different doctor, a different nurse, yes, the guy and still they're like, no, do I my paddy man? He's my paddy man. I can now do anything I want to do. But I can open up. Tell him that, hey, my arm is like this, or my leg is like this. I feel here, down here, on my waist, all those kinds of things. You can open up. Mistreatment seen as normal. Example, you're in your marriage house because they said the man is the leader, the head of the house. You just allow him to be beating you, talking to you anyhow. Mm-mm. It affects your mental health. It affects your self-esteem. The more the man looks down on you, the more you look down on yourself times two. The more you look down on yourself times two, and that confidence, that standing up for yourself, as our founder rightly said, as she said earlier, that when you're being informed, you have that confidence. You're able to stand up there and fight for yourself. Stand out. But because we will remain in our husband's houses, what they said is for better for worse. Better for worse. Just say no. I'm here. I'm just here. Let me be here. I don't support such, and I pray that we should rise up and fight for ourselves, and know these rights. Go into research, even if they are the minimal rights. Go into it about them, act on them. You can even join women empowerment forces around. There is one in Bola, and I believe it's in all regions, everywhere you find yourself, organizations, NGOs that are concerned with women's health and the well-being. You can join. You can do them. So I would like to say something like seven. What respectful woman-centered care looks like. If you feel difficulties or you have difficulties in um, interacting with women or with people, and you don't really like, you're not really open. Let's say because to treat someone badly. Listen attentively. Explain before carrying out any procedure on that patient, on that woman. Explain to her. Ask for consent first of all before you do anything. You can sign documents legally. The theme of this year's International Women's Day is Rights, Justice, and Action. Justice, that's what is going to take. You want to know your rights. That is your legal support. Justice backing up, and action to show that you're standing up for yourself. It makes everything stand out. So to conclude, I would like to encourage you to write and to claim your power. You are very strong. You are very, very well embodied and well made. Yes. The fact that you are able to go out there and give birth, give life to a new generation, you are really, really strong. And I commend all my ladies here, my mothers, my aunties, my my leaders, my all the beautiful ladies here. Thank you very much. And remember to stand by your rights. For a woman who knows her rights, protects her life and dignity. Enjoy this day, celebrate this day. Don't go and drink, don't go and drink and fall, but celebrate it with dignity, upholding yourself and always smile. Thank you, Miss Kimby, for this opportunity. Thank you, informed mothers. Thank you.
All right, thank you so much, Miss Ruth. I think Miss Kim is out, her network is disturbing. So thank you so much for your presentation. And here's a call to action. I believe each and every one of us have learned one or two things about a woman's right. And one striking thing Miss Ruth said was, when as a woman, when you know your right, you know your dignity, and you can defend yourself confidently. I'm so grateful for your presentation, and I will each and every participant, please let's make the chats very lively. Anything you've learned, just drop it in the chat. And for the questions, if you have a question that has to do with Miss Ruth's presentation, please you can just jot it down so that after every speaker speaks, we can give the floor to questions and answers. Thank you so much. Without further waste of time, I would like each and every participant to unmute their mics. Please, can we unmute our mics? For those of us who are Cameroonians, we're going to do a little exercise. And then those that are Nigerians, I'll explain so that you can join us in the little exercise that we're about to do. I think we know of Womane, we say, you know the response. So when I say Womane, you can shout at the top of your voice and then you give me a response. I don't know if I'm actually saying what it's supposed to be said, but I know that we always do this mostly during Women's Day where we say woman A, we respond that A, right? So please, can you? All right, let me do that right away. I don't know if you can see me.
Yes.
All right. So this is what I'm saying. Please, can we unmute our mics? Dear participants. Are we there?
Yes, we are.
All right.
We are there.
That's nice. That's nice. Thank you so much. So this is what I'm going to do. We know woman A. Then we respond with the fist bump. Yes. We raise our fist up. Woman A.
Hey.
Yeah. Thank you so much. Thank you. So riding on, we're going to go straight to our next speaker. Please just a moment. We're going to go straight to our next speaker. And the next speaker will be talking on informed choices. Informed choices. And I'm going to give a little about this great speaker, who she is, and what she does for a living. This speaker, she's a public speaker. She's in a public health. She's a public health student and a graduate of human anatomy with a strong commitment to advancing maternal health and child dignity, with a background that bridges biomedical science and community health practices. She brings both scientific insight and grassroots experience to her work. She serves as a frontline officer and a data analyst, roles that have strengthened her understanding health systems, service delivery, and evidence-based intervention. She is particularly passionate about promoting child dignity through advocacy for family planning, informed maternal care, and safeguarding practices that protect women and children. As a volunteer with the CYPF in Nigeria, I guess most of people already know, I've already disclosed the country where she's from. She actively contributes to initiatives focused on youth protection, safe space, and rights-based education, driven by deep belief that informs choices lead to healthier family and stronger commitment. She continues to use her voice to educate, advocate, and inspire her generation as she steps into parenthood. This speaker is no other person but Ebute Sarah. I don't know if I'm pronouncing your name well, but please pardon me. Can we put our hands together as we welcome Miss Ebute Sarah?
Thank you so much. Yes, it's able to you tried.
Thank you. I'm glad
Please permit me to not use my video. I don't have lights at the moment and I don't like how blurry it's looking. So thank you very much. I'll be talking
Hello.
speaking on.
Sarah, please, can you hold on for a minute?
Okay, all right.
I think the MC got it all mixed up. Actually, our next speaker is Miss Ode Tayo. So
Okay.
it's on the screen. It's on the screen. So please, if Miss Ode Tayo is ready, she can come up. But if not, then Miss Sarah can go on. Thank you.
Okay. Good afternoon, everyone.
Good
Happy
afternoon.
Independence Day. Okay, first I want to appreciate the founder of this Informed Mothers, and I would say is a great opportunity to come together to learn and educate ourselves. As we have seen on the slide, informed choices. And also I want to appreciate Ms. Ruth for the wonderful presentation on women rights. Please, the next slide. Now, for every woman, whenever we make healthcare decision, we should never take action in confusion or out of ignorance or out of fear of, oh, I don't know what the nurse will do. I don't know what the doctor will do if I don't cooperate with them on this, even when you don't understand. Also, we should never take action in silence. But when we talk about informed choice simply means that you are taking decision from the place of understanding. And for understanding to come, it means the healthcare providers are able to give you accurate information about your care. They are able to explain things to you and also to carry you along your management. So we must understand that before you can say that, oh, as a woman, I'm making informed choice, you must have accurate information. It's not misconception, it's not myth. You must have clear explanations, understanding of risks and benefits. Also, you must understand other available alternatives. And henceforth, I do hope that yes, we begin to make informed choices at every point. We can have the next slide.
Miss Ayomide, are you there? We can't hear you. All right. I think Miss Ayomide has issues with her network. Hello, everyone. I think we lost Miss Ademoye. I don't know. While waiting for her to resume, can Miss Sarah be prepared? Can she? I don't know if you can move to her next slide rather than wasting too much time. All right. Miss Sarah, are you there with us?
Yes, I'm here.
All right. Thank you so much. You just take up the floor while we wait for Miss Ademoye. Thank you.
Thank you for the opportunity. Good afternoon, everybody, and happy International Women's Day. I'm happy to be in your midst this afternoon. I'm going to be talking about informed action, self-advocacy for women. Now, what is self-advocacy? Please, will someone be doing the presentation? I can just continue with my slides here. I think Miss Ayomide Odetayo is back.
Okay, please, can Miss Sarah just continue because
Okay.
I'll just she's done.
All right.
My phone's getting hot.
All right, thank you. Now, self-advocacy is simply the ability to speak for yourself. It is the ability to identify your needs, communicate them clearly, and help others to understand how they can support you. It also means making informed health decisions, asking questions, and seeking clarity. It means knowing you deserve care. Why does self-advocacy matter? Self-advocacy empowers individuals to communicate their needs, assert their rights, and take control of their lives, leading to increased independence, confidence, and improved personal or professional opportunities. Self-advocacy improves health outcomes. It prevents medical errors. I'm going to get to that shortly. I'm supposed to give a real life story. It also encourages shared decision making. Now, let me give you guys a real life story that we'll use to understand this concept better. A pregnant woman, as they introduced me earlier, I am a frontline officer. I work in a hospital. A pregnant woman went for her first antenatal visit. Like, she did a routine investigation in a different facility and came to do another one. Like, all her life, she knew she was O positive. Hope you guys are listening. Can you hear me? All right, thank you. So all her life, she has O positive. She knew herself to be O positive. Then when she did her routine antenatal investigation, blood group is one of them. The result came as A positive. So I don't know how she discussed it with the doctor, but she came and met me. Me, I don't even have like much power, but when she met me, I knew, yes, this woman needs to do a confirmatory test. She told me, and she told the doctor that she needs to run another test to confirm, because she has two different blood groups. So I was like, yes, she's supposed to go to the lab, and they're not supposed to charge her again. Let her run this test, since our result is not the same with what she had initially. So after much insisting, she did the investigation, and the blood group came out O positive, what she believed earlier. So imagine she didn't speak up. Some people are so calm, they feel like, I'm just a calm person. After they told her results can come like that, imagine she just left it and she did not say, she not insist on repeating the result. They would have used that in a positive in the hospital. Then during time for delivery, and maybe she needs an emergency blood transfusion, her record in that hospital would be A positive. So they would have transfused her with an A positive blood, leading to, which could have cost either her life or the life of her baby. So what is this story trying to tell us? If you sense that something is not right, speak up. This woman's advocacy protected her life, it protected her baby, and this is the power of informed action. Now, how do you advocate firmly? Respectful but firm advocacy is an approach, a strategic approach that balances conviction with civility, enabling individuals to stand up for their rights, needs, or causes without resorting to aggression or demeaning others. The story I used, the woman, she was not shouting, but she was firm. Like, I just admired her. She was firm. She needed it done. She was not shouting. She was not, but she was firm and insisting that, yes, I need my blood checked again to confirm. How do you do this respectful advocacy? Let's use let's say antenatal cases. If you are going for, not only antenatal, if you have never read antenatal, going to the hospital, you are supposed to have some questions prepared before your appointment. You can use calm and clear languages, then request simple explanations from the caregivers. You can also ask about alternatives, and other options. Like the first speaker said, she said we should know our rights. And one of our rights as patients, because this scenario we are talking is about informed choices in the hospital. One of our rights as patients is asking questions from your caregivers, and you have the right to ask questions, and you have the right to receive answers to questions. So even if you don't take anything, take this one from Heather, you have the right to ask your doctors questions, and you have the right to receive answers from your doctors. How do you respond to dismissal? Let's say as she told them that, I need to do another test to confirm because this result is not sitting well with me. Imagine they told her, go, it happens. Result can like errors like this happen or things like this happen, how do you respond to it? You can repeat your consent clearly. You can also request documentation if they refuse to grant your request. You can seek second opinions, bring a support person, like maybe your husband or a family member that can come and help you. In this woman's case, she came to meet me to I don't know if I was her support person in that case, but she came to meet me because she needed someone else there to understand what she was trying to say, to explain it better because to the person at the lab so that they would take her sample again. And another thing that can make you respond to dismissal is knowing your rights as patient rights. If you want, you can go through them, like go through the first speaker speech. When you know your rights, you know you'll be more confident to act on it. Now, community action. Let's talk about community action. You can share information with other women, encourage peer support groups, mentor younger mothers, then advocate for respectful maternal care. Let's say from your experience, you can decide to use your experience as a story to help other people so that you know encounter a kind of, maybe if it was a bad situation you encounter, so that you know encounter what you have encountered. You can share the information with other people, your peer group, or even people younger than you. Call to action. This is like a summary. Know your rights. I'm going to emphasize on it. There's anything you take away, at least know your patient's rights. Know your rights. Speak up with confidence. When you know your rights, you'll be able to speak with confidence. And when you speak with confidence, nobody will be able to refuse whatever request you are asking. In fact, they won't be scared on your behalf. They want to attend to you so that you not bring up any form of issue because they know deep down that you know what you are talking about. Support another woman's voice, like the informed mothers is doing now. God bless the founder of the initiative, Madam Success. You can support other women's voice. You can stay informed and empowered. Feeling respected is an important part of wellness, and sometimes it takes a little self-advocacy to get that respect. So, my fellow women, this is the end of my presentation, and I want you to take home at least this International Women's Day that if something is not sitting right with you, not only in the healthcare facility, wherever you find yourself, if something is not sitting right with you, speak up. If you don't know your rights, study your rights. Now everybody has a smartphone. Browse, what are my rights as a patient? What are my rights if it's in the bank they are doing this to you? What are my rights? Quickly browse. When you know your rights, it will give you that confidence to speak. And when you speak with confidence, the people you are speaking to, the people that wanted to oppress you, they will respect you and they'll give you that respect you want, and you will get that which you want. Thank you, everybody. Thank you for the opportunity. And I hope you had a lovely International Women's Day. I hope when next something does not sit right with you, you will speak up. And wherever I am, my spirit to be glad that at least I made someone to speak up. Thank you very much.
Oh, wow. Thank you so much, Miss Sarah, for this wonderful presentation. I would like each and every participant to unmute their mics and let's give a big clap to Miss Sarah. I've learned one thing and I hope each and every one of us have learned one or two things. Please, can we unmute our mics and give a big clap to Miss Sarah? Thank you so much. Thank you so much. Thank you. In her presentation, I got one key thing. I am my own best advocate. That's affirmations for appointment. And during her call to action, she said that respect is a very vital key in healthcare. I deserve to be respected. It's not a choice, it is my right. Respect in healthcare, it's not a privilege, it is a right. Thank you so much, Miss Sarah. I don't know if our next speaker is on. All right, Miss Kim, please can you take over? Let me get to our next speaker, Miss Ayomide. Please, can you take over?
Hey, thank you very much, Miss Sarah, for this incredible presentation. Please, right now, since we are still waiting for Miss Ayomide to come up, please, if you have any questions from the first speaker who spoke on informed rights and our speaker who just spoke on informed actions, please write them down in the chat box and the speakers are going to answer the questions simultaneously. So from the first questions from the first presentation was where our speaker was presenting on informed rights. One of the key takeaways I took from this session is that knowing our rights is the first step towards protecting our health and dignity. So if we don't know our rights, we cannot protect our health. We cannot even protect our dignity out of health. And some of the fundamental rights that she talked about us, right to information. And that's exactly what we're doing here. You need to have information about your rights for you to know about your rights. Because if you don't have information about your rights, you're not going to know your rights. You also have the right to informed consent. That is, you need to give your consent before any treatment is given to you, any procedure is done on you. Your consent is supposed to be given. It's not imposed. Your rights are not supposed to be forced on you. It's not something that is imposed. It's supposed to be chosen. It's your choice. So informed consent is needed, and it's your right to give informed consent. And it's also your right to refuse the treatment. If you don't want treatment, you have the right to refuse the treatment. As long as it's good for your health, it is your right to refuse the treatment and your right to respect and dignity. As a woman, it's very important for us to have our own dignity, because if you don't have dignity or even respect, you're always going to feel less about yourself and less confident, which takes us to right to privacy and confidentiality. Your information is not just supposed to be out there without your consent. You have the right to have your privacy. You have the right to be confident about your privacy and telling them no, that your information is not supposed to be out there, no matter how tense the situation may be. And we also need have our right to choose our provider in the hospital. You have your right, if there is a nurse or a practitioner that doesn't treat you well, it's your choice to choose another provider. As long as there are other options, it's your choice. And if the care is not given to you, it's your choice to also refuse. If the care you need is not given to you the way you want it, it's your choice to choose. If you don't want that care to be provided to you by their provider. I don't know if Madam Ayomide is here. There's a question that is asked in the chat board that did you know that you can refuse a medical treatment? Because I think many people don't know about this, and it's your right to refuse that treatment. Please, if you know, or if this is the first time you're getting it, please indicate in the chat board. And also, why does this right matter to us? As why does this when women know their rights? Obviously, when we know our rights, we experience better health outcomes. You know what is good for you. You know that you can decide, you can choose what is best for you. So knowing your right is going to better your health outcomes, and it's going to lead to fewer complications from lack of information. This is very important. It's very important for us to research. It's very important for us, for women, to have access to this information and learn about this information, because lack of information can cause a lot of complications to us as women, a lot of complication. So it's very important for us to know about, to have knowledge, which is why these events are being brought up for us to learn more about ourselves, to learn more about what is good for us. And know your own rights is also going to lead to more satisfaction with care. As I earlier said, you can choose your provider, you can refuse treatment, medical treatment. You're not going to get medical treatment where you do not want, like maybe the treatment trigger some effects, it can cause some adverse effects that is going to make you to be uncomfortable. So know your rights to choose this is very important, and it's going to lead to more satisfaction to care. It's also going to reduce medical errors, violation decreases. Yes, violation decreases, and patient provider relationships improve. Exactly. If you can explain if you can explain to your provider that this care is what the provider wants to provide to you is something that always causes like an allergy or effect to you, and you knew that you have the right to tell the provider, it's going to make work easier and reduce more medical errors and also improve your relationship with your provider. Okay, these are when do we use our rights, please. Before I continue with this, is Madam Ayomide already in the chat. This is Madam Ayomide back. Please, if you're back, indicate in the chat. While waiting for Madam Ayomide to indicate, when do we use your rights? You can know your rights, but you don't know when to use it. So when it's always important to use your rights when you don't understand something. Ask when you don't understand something. Don't just follow people blindly. It's very important for you to ask when you don't understand something. Ask when a medication is given to you and you don't know where that medication is given to you. The caregiver is going to explain to you why these medications, so that if there's any complications, you know who to blame and who not to. You also when you can also use your rights when you feel rushed into a decision. As I earlier said, you are not supposed to be forced to do anything. If you're rushed into a decision and you know your rights and it does not align to your rights, that is when you can advocate for it. It's your choice. Giving.
All right, everyone. I think Miss Kim, we've lost Miss Kim due to network issues. Once more, Miss Sarah, thank you for your presentation. It was very powerful, extremely powerful. So I would like to share an experience in line with the true life story you spoke about. I remember a case. I just got into med school, and at a point we were being forced. We are being forced by a medical doctor to move out of our unit to get to the blood bank so we can donate. So we can donate blood since it was World Donation Blood Donation Day. I didn't initially want to go, but I had no choice because I was still a student back then, and I don't know if everybody can hear me. Please, if you can hear me, just indicate. And I would like to stand for the fact that you being your best advocate, it's very important. It's very important. And I forcefully went into the blood bank unit, and when I got there, my sample was collected. And later on, after some few minutes, I was being called to come and donate the blood. Then this TV station walked into the unit to do some interviews since it was their day and we were being asked to move out, only for me to come back and I received my results in the envelope stating that I cannot donate because it's showing that I've been diagnosed of hepatitis B or something. I can't really remember. I think either hepatitis B or hepatitis C. And I I was like, no, I've donated blood before. This is not my first time donating blood. So why would this come up? There's a mix up. So this nurse walked up to me and told me that it has happened, it has happened. So I was just referring to a doctor and see how your treatment can start and stuff. I went immediately, I left the hospital that day. I didn't go back. I didn't go back to the hospital. I called my dad and I was like, are you in the office? I'm coming immediately. He was like, what happened today? What happened? I said, are you in the office? I'm done with med school. I don't want to do anything again with med school. I cannot. He asked me what happened, and I told him that I want to go to another hospital where I will get tested because explained everything to him. And when I got there, they said everything is okay. It's negative. I don't know what the problem is. I went to the next hospital. I got a confirmatory test, and it was showing that I had no I had no hepatitis B, no hepatitis C. And so when I moved back to the hospital where I was practicing as an intern at that time, I showed the lady who told me that she's going to refer me to the medical doctor to proceed my treatment. And I showed her the results. These are results from two hospitals. So what do you have to say? She just told me that it was a mistake. And because since the people who came to interview, maybe my results was swapped with another person's results, and you all know the history, and so it's not her fault. And I just told her that anyways, it's okay. But for me, that it has just cost me, like, for me to get to that particular hospital, to get medical attention, it's kind of very difficult because of the stigma they had put me through. So being an advocate for yourself, just imagine that, okay, I didn't head to another hospital for a confirmatory test. I would have been taking drugs or medications, going in for procedures that I don't even know what I'm doing. So being an advocate for yourself, it's very, very, very important. Very important. And as a medical practitioner, one thing I've noticed is that most of the times women, pregnant women go through a lot, the emotional, the psychological, the hormones as a whole, they go through a lot. And being an advocate, you being in the front line, you being in the front line as a medical personnel who meets these pregnant women, who meets these families, I think you have a greater role to play in each pregnant woman's life or in each person's life. I've seen cases or I've observed cases where women don't have autonomy. They don't have the power to speak for themselves. They don't have the power to speak for themselves. And you see in cases like, I work in the remote areas, you see cases like women don't come in for antenatal. And the day they succeed to come for antenatal, they're like, oh, no, my husband didn't provide me money. My husband said there's no need to start antenatal early. I have to start at 7 months or 8 months so that I just do come for 1 or 2 antenatals and then I put to birth. So it's really difficult. And this is already an action for us to take. This platform already, it's already an action for us to be equipped to get the right information and we can spread the information out there. Truth is that people at the remote areas, they're going through a lot and I don't really know how this can actually get to them because on my own I cannot do it. So it's just to share the message across with one person, the other person shares, the other person shares, the other person shares. So in line with everything, first you have to know your right, because if you don't know your right, you won't know what to defend yourself for. Secondly, you have to advocate for yourself, and you cannot just advocate for yourself. Most of the times we say we are advocates for ourselves, and the way we communicate, I think in Miss Sarah's presentation, she made mention of using a clear language someone can understand, and then your body language too. Just to add to that statement, your body language too is very important. Don't be advocating for yourself and you're very assertive. This is assertive way of communication. We have the aggressive way, we have the assertive communication. And so you cannot be telling me, you cannot be rude to me and you're telling me that I'm just being assertive, I'm just standing up for myself. So the way you communicate, it's very, very, very important. This is not just about pregnant women, it's about us in the platform. Most of the times we might just feel that no, this is about women who are seeking going to hospitals to get prenatal care, to get family contraceptives, or to put to bed. No, it starts from within us. You might not be married now, or you might be married, or you're still having a long time to start making this type of life decisions. So it starts from you within. If you are not confident about yourself, I like the assertive, the affirmations Miss Sarah inputted in her presentation. It helps when you say these things and you believe them. It works. It works like magic. Don't just say them and then you sit back that no, I've said it. Even the Bible says it. Faith without works is nothing. So when you say those things, you should be able to work for it. Don't say I am the best advocate for myself, and when it comes for you to speak, you're just seated quiet. You cannot speak. You're shivering. Then no, what will people say? I have suffered this for a very long time, where I just feel like no, I don't have the right to say anything because I want to keep relationships, because I want to create peace. No, it's wrong. It's wrong. The way you present yourself, the way you're trying to be assertive, like I said, your communication skills matters a lot. It matters a lot. When she was presenting, I remember a case where a lady walked up and met me. She came in very wounded, and she came for antenatal. She came in very wounded, and so I'd already known that okay, I know that you're just in with your hormones and everything. I already understand. And from the guy at the receptionist, they started having problems. And when she got to my office, I just spoke to her, and then she turned and looked at me when she was leaving. She told me that I'm different. I'm so different from everybody who works here. I said yes. I noticed the way she came, and I knew that something might have happened at home, or she might be going through a lot of things. And our mental health too. When we meet women, we don't know what they go through at home. Just you being there and willing to listen as the frontline health personnel helps them a lot. So I'll still say, let's know our rights, not just for our clients, for ourselves as well. You cannot give what you don't have. You cannot give to people what you don't have. I don't know if Miss Ayomide is already there, or do we have someone to represent her?
Yes, I'm back.
All
It
right,
was
thank you.
like,
Thank you. It's okay. So you can just take the floor.
all right, thank you so much.
You're welcome.
Good afternoon again, everyone, and happy International Women's Day. And also I've learned a lot from the presentation from other speakers, and I really want us to move from just gathering information to doing. And this is what informed choices is all about. Is you practicing what your right is you practicing what you have been informed about. Now we can have the next slide. I think I've done the introduction already. Okay, so the part of healthcare provider, it is, yes, we have a big responsibility to play. And also I still don't want to remove the part of the public, because sometimes some patients, even when I educate them, sometimes they feel like it is too much. Some don't even want to pay attention to you explaining what their condition is. They'll just tell you, nurse, just give me the medication, I'll be fine. But what they don't understand is that if you don't understand what is wrong with you, you are not empowered to take care of yourself. So I want to say this as part of the public, and for every woman present on this call, please, I want you to not only advocate for yourself, but also advocate for others. You are sister to someone, you are daughter to someone, and you're a neighbor to people. Like you carry this influence of change. And for everyone you interact with, just everything you have learned from here, take it out to the community, take it out to your space, and create the change there. So why informed choices matters? It matters. And before now I'm using woman, but just have in mind that I'm talking generally to every recipient of healthcare services, but I'm using woman for this call. So you must have the accurate information, you must have clear explanations, you must understand the risks and benefits, and you must understand available alternatives. Now, your role in this place for informed choice is that when you are being educated, please don't be in a hurry to, don't be distracted. I have visited antenatal clinics, I've conducted researches, and I tell you sometimes, some people feel that antenatal clinic is a waste of time. Why some women appreciate it. And I just want us to have a right attitude towards using healthcare services. We can have the next slide, please. Okay, now the ethical foundations of healthcare decisions. We've talked about your rights, and I'm bringing the place of ethics. For every healthcare provider, the decisions we make, our judgment, the way we behave, or our attitude towards patients is guided by ethics. And these ethics are in place so that it can check our behaviors. It can check what we accept to be the right thing and the wrong thing when it comes to interacting with women in the healthcare space. So the first is autonomy. Every woman must understand that you have the right to make independent decisions. You have the right on what happens to your body. Nobody can just, call you somewhere, begin to do a procedure to you, and you don't even know what they are doing. And you're just there. You're not questioning. You're just, you don't want to challenge them. You're just keeping quiet, and you are suffering the consequence of whatever it is that you are doing. So please, you must understand that you have the autonomy. You can make independent decisions for your healthcare services and care. Now, the beneficence. Beneficence means that as a healthcare provider, I must have the best interest of my patients. Now, I must have the best interest of the woman coming to receive the care. I must do everything that will benefit her. So that's meaning of that beneficence, doing what will benefit the recipient of the healthcare services. So now we must understand that anytime you are receiving healthcare services, anytime you are receiving a care, you must not be coerced into it. You must not be manipulated into it. It should be from a place of, okay, it is going to benefit me and it's not going to harm me or be detrimental to my health. Yes, I know sometimes some procedures can have their own risk, but it should not be to the end that it will harm the woman. Then non-maleficence means that you must not do evil. Yes, you must not do evil to any recipient of healthcare services, and you must ensure that in everything you are doing, and this is the place for healthcare provider, I must keep on growing, I must keep on learning to ensure that I'm competent to deliver the care, to deliver the services these women are seeking for. I must not see my patient as, okay, I can just do anything. Whatever happens to her is none of my business. It is my business. And that is the reason I'm showing that there are ethical foundations for informed choices. Also, justice. Justice is about fairness, it's about equity. You must not talk down to a woman because maybe her husband is not present with her. It's none of your business if her husband is not there at that time. You must attend to her the way you attend to a person that her husband is also present. Okay, we can have the other slide just to be quick. Okay, importance of making informed choices. Now, making informed choices will protect women's rights because women begin to speak up for themselves. Women begin to ensure that things are not just done to them anyhow. They are not just mistreated. They are not just treated like case file. Yes, I tell people that you don't treat your patient like case file. This woman, she has a soul, she has a body, she has a spirit. You cannot just treat her like you are treating the papers you read on the EMR. No, you need to understand her. You need to ensure that you are giving an holistic care for the woman. So when you make informed choice, it protects your rights. It also empowers you. I tell you, if you understand your management, if you understand what these services you are receiving is, if you understand fully, there's a way you contribute to the management. There's a way you cooperate. There's a way you adhere to whatever we are telling you. And I've seen this firsthand with my patient. I can remember a mother with a child, and she was referred from an hospital. She came to my hospital, and at that point, I had to educate. After education, I emphasized the need of ensuring that the diet of our child, things that is needed for our child. And she cooperated because she understood why we are doing those things. So most times, sometimes from the aspect of healthcare provider, I know, yes, you might have seen some healthcare provider that they are very difficult, they are impatient. See, I can tell you for a fact that healthcare, attending to patients can be very stressful at times. I've been in a situation whereby I have to feed the baby of a woman, and at that point, I was sick. I was still taking medications, and I was unable to get the sick off because other people are also sick again, and I can still walk. So at that moment, even when I got so exhausted, I just had to excuse myself, listen to music, then come back to my smiling face because I just don't want she has a preterm, and I don't want my own containers to also affect the journey of the mother which she just started, and that's her first child. So I just try to ensure that whatever thing I'm facing, I don't transfer it on my patient. But for other healthcare providers, they might not have that capacity to ensure that, oh, they know when to adjust to situations for patients. They don't lash on patients out of anger or out of stress. Then another thing that it reduces anxiety and confusion, and that's just the truth. If you understand your care, if you have the accurate information, you are not going to be confused. Anxiety will be far from you because you know what is being done. Just
Hello. Network issues.
Miss, are you there with us?
Hello.
Miss Ayomide, are you there with us?
Please, if Miss Ruth is around, she can continue the presentation.
All right. Miss Ruth,
please,
are you
if
there?
you're there.
Yes, I'm there.
All right. Please, you stick to time.
I think she's done with the importance of making informed choices. Can we just move to the next slide so that we'll manage time, please? Good afternoon, everyone. So I'll just continue from where Ms. Ayomide ended. Right on, we'll be talking on health literacy. Now, when we talk about health literacy, is the ability of a woman to have access to health information. It means that you know what to do, when to do it, and how to do it. And that is one reason why we are here. Today, we want to give out information to women. It means that if you are present on this session, before you leave here, you must have had information that if you are to visit a health facility, you know what to do, how to do it, and when to do it. Health literacy will also help you to understand medical instructions. It means that if you meet a health practitioner on discussion, on consultation or any other thing with a health practitioner, you will know what to do. For example, they can explain a procedure to you and you don't understand. It is your right as a woman to ask questions. And that is why we are always saying, ask why. You asking why does not mean that you are disrespectful. You just want to help you to have, when you ask why, you will have informed choices. Yes. So health literacy will also help you to communicate effectively with your healthcare provider. I think our last speaker was talking about assertive communication. You talk in a very calm way. Even when something is disturbing you, we know that sometimes your health situation can make you to be so, communication could be so bad in such a way that you don't even know how to communicate. But sometimes it's always good to calm down, because when you communicate calmly, an individual is bound to understand you and get it in line with you so that you people come out with correct decisions. Health literacy will also help you to make appropriate health decisions. That is why we're saying that when you have access to health information, when you have access to proper health information, you will make appropriate health decisions. Health literacy will empower women to take control of their health and well-being. And by so doing, we'll have good health outcomes. Please, the next slide. Why does it matter? It will enhance informed decision-making. Now, when you have access to the right information, you are going to make the right health decisions. You will take the right health decision. Because sometimes, for example, a woman will come in labor. On examination, labor is not actually progressing. Labor is actually progressing, but dilatation is poor. Sometimes a medical doctor will tell you that at this point, madam, we need to do you an operation. Now, some women will say they don't want operation because of the myth society has made it. They will say, if you put to bed through CS, maybe we might not put to bed normally again. If you do like this. No. When you have the right information, for example, during ANC, you are coming during ANC and they tell you that these are some of the things that might make you to have a CS during labor. You already know this information. So by the time your doctor is telling you that, madam, we need to move to the theater, you already know what is at stake. You know the importance of what is there. So you will not even need to argue. Sometimes when you know information, the health process, care is very fast and swift. So you just move to the theater already knowing that if I don't go to the theater, it is a risk for me and the baby. So when you know the right information, you have to take informed decisions. Now, you will also improve health outcomes. When you take the right health decisions, obviously we will have the best health outcomes. It's normally going to reduce maternal death. It will reduce neonatal death. And at the end of the day, it is a celebration. It will also encourage healthy lifestyles. Of course, it's normally going to encourage healthy lifestyles, as we know. That one is simple, and I think everybody can get it from there. It will improve communication with healthcare providers. Yes. When you have access to the right information, you will know how to communicate. That is why the last speaker actually spoke of, I've talked about the assertive communication. Sometimes you just have to calm down, communicate properly, ask questions. That is why they are saying that before you visit your healthcare provider, you are supposed to jot down questions. Write down your signs and symptoms. You take your results of the last visit along with you. All of this information is going to enhance communication between you and your healthcare provider, and it's actually going to save time as well. You will promote preventive healthcare practices. Some of the things that are supposed to happen along the line of care, that is bad things. When you have the right information, some of these things will not happen. You actually prevent them. It will actually reduce healthcare costs. Normally, when you know something, you know how to do the thing and you know when to do the thing, it's going to reduce costs. It will reduce costs very much. Because sometimes people spend a lot on healthcare because they are ignorant. They don't have the right information. You go to the wrong places. Where you are supposed to visit, you are supposed to enter the lab. You go and enter the wrong place. What you are supposed to do, you first of all go and enter a pharmacy for buying drugs, but you don't even know what exactly is disturbing you. That is to say, if you are having a disturbance, you actually go to the hospital for proper consultation. You don't visit the pharmacy to buy drugs because you want to do blind treatment. By the time you want to do blind treatment, at the end of the day, you will discover that you have spent a lot because you might go to do blind treatment and you buy the wrong drugs for the wrong illness. And at the end of the day, it gets more severe. When you visit the hospital, you will discover that you have spent a lot. It will also empower the community. Of course, and that is why we're saying that if we are on this session, 17 of us, it means that at the end of the day, we should be able to communicate or to send out this same information to more than 17 other women. For example, if we say that each individual that is on this session is supposed to educate other 2 women, we have done a lot, because one informed woman who has taken that information out is equal to a community that is informed. A whole community is already informed. Because when a woman is informed, she might definitely carry the information to her Njangi group. She will definitely carry that same information to her social group. She will definitely take that information to her workplace, and information will go through. And by so doing, it will empower the community. Please, the next slide. Now, we'll be talking on preparation for a healthcare consultation. When we talk about preparation, what are you supposed to do before you visit your health practitioner? Before meeting your healthcare provider, preparation is very, very important. How do you prepare? You write down your symptoms. Because sometimes you might be feeling ill. Before you reach the hospital, some of the signs and symptoms have disappeared. And if you did not jot them down, you might forget. Some of these signs and symptoms, they usually appear on and off. And sometimes, because they are not showing immediately, does not mean that they have actually erased themselves. No. Some of these signs and symptoms might come by in the night, and you go to consult during the day. You might forget to say that you have a headache at night, or you have night fever. So it's always good that you jot down these signs and symptoms that you have at home before you prepare to go and visit your health practitioner. You gather the previous test results or medical records. I spoke about this already. On visiting the hospital, you do not allow your previous test results or what was said behind. You take them, because it's from the last result that your health practitioner will be able to relay or to tell you exactly what is happening. For example, a patient that is a hypertensive patient, you might walk up to the hospital today and they do you BP control, and they discover that your BP is actually high. The only thing that health practitioner is about to tell you, looking at the results that he or she has conducted, is that you are having a high BP. There is nothing further to say apart from counseling. But now, if you are taking your previous results, now the health practitioner is liable to say that according to your last result, it is showing that your BP has increased from this number to this number, or it has reduced from this number to this number. And the information is clear. And when you look at the values, you will compare. You will know either you are improving on health or it is worsening, and the right decision will be taken at that moment. You have to list medications that you are currently taking. That is why when you enter in the hospital, on consultation, they will tell you, what are you taking? What have you been taking? You will come to the hospital and say that you have serious frontal headache. They will say, madam, what have you been taking? You say you have taken para at home. They are not asking that information for fancy. They are asking it because they want to know how far it has been. And it's always very important to each time that you are taking a medication, you note the medication you are taking and how you are taking it. Even if it's traditional medicine, take note of it, because they will come and tell you what are the auto medications you have been taking. You say you have taken paracetamol, you have taken amoxicillin. It is very, very important, and it's a vital information that you need to take along with you. You will prepare questions in advance. Preparing questions is very, very important. That is why informed mothers will tell you that always ask why. If they tell you that, madam, climb on the bed and remove your pants, you ask the person, why am I moving my pants? If they tell you that I want to touch your breast, tell the person, why are you touching my breast? You are supposed to ask why. It is your body, and you have to have the right. It is your right to know why they are doing this particular thing to you. And is it beneficial to me? You have to practice beneficence. Now, the next thing is, you have to bring a trusted companion alongside with you. You don't just go to the hospital randomly, except the worst has come to the worst. Or, for example, a pregnant woman is walking up to the hospital alone. Sometimes it's not really making sense, because most of the times, for example, if you're a married woman and you get to the hospital and you're pregnant, sometimes tiredness will make you to forget some of the things that are disturbing you. But if you are bringing along with you a trusted companion, for example, your husband or your sister or anybody that is by you, some of these things, when you even forget, they will tell the health practitioner that she's like this and now she does not sleep, or she's not drinking water very well, or she's not eating very well. They are going to help you even bring up some of the information you have forgotten, and to make sure they ensure your safety. Because sometimes some of these health practitioners, they are funny. When they see for example, a pregnant woman comes in, the way they are going to treat you when you are alone, sometimes it's different when they will treat you when your husband is there. Because when your husband is there, they know that it's a whole thing, and you cannot do anything. You cannot disrespect her in the husband's presence. Please, you can move to the next slide. What will happen during your consultation? During your healthcare consultation, you have to listen very carefully to explanations. Yes, you have to listen very carefully to explanations. It means that during communication, if the health practitioner is about using some terms that you cannot understand, you ask, what did you say? I am not understanding. Can you please bring it to lower terms? Because sometimes some of these people will use medical jargon and they want to kill your head with it. Don't be afraid. It is your right. Ask them, what did you say? I want to understand. Ask for clarification when needed. You need to ask. Always ask why. Ask why all the time. Request simpler explanations if medical terms are confusing. That is what I was saying. Sometimes some of these people, they will use severe terms that you cannot even understand. But as a woman who knows her right, as a woman who knows her health right, you are supposed to ask. All of those jargons are not your problem. That is not the reason for which you came there. You should not come there and you are having fever and somebody be saying that, okay, because you are having pyrexia. That is stupidness. Yeah, the person is not supposed to talk to you like that. Some of these things are just to confuse you. So when they use their terms, it is for them. Ask them, what did you say, sir? Please, I want to understand you. Take note or record information or record important instructions. Yes. Because sometimes they will tell you a lot of things. If you don't take notes down or if you don't record these important instructions, you might reach home that you have forgotten some of them and it will be very bad on your side. So you need to record some of these important instructions. You discuss all available treatment options. Yes. Sometimes you will come to the hospital and you're sick of malaria and a health practitioner decided they want to give you quinine therapy. And they tell you, you ask, if somebody tells you that they want to give you quinine, you say, why are you giving quinine? Or what are the advantages of quinine and the disadvantages of quinine? They say the advantage is that it's going to help you very fast. It's going to treat malaria. But it's that during the treatment process, you are going to have ringing ears. As somebody that knows that there is artesunate to be given, and you know how artesunate, side effects and the importance of artesunate, you will compare these two and you decide to choose. When they tell you, they say there is artemether, there is artesunate, there is quinine. They tell you their side effects. You will see the one you can manage, and you have the right to tell them, I don't want quinine, I want artesunate. They should give it to you. It is your body, and you have the right to decide what is to be done to it. That is your decision. Should be the one that is going to benefit you and your health as well. Please, the next slide. Thank you. Say this to yourself every day. Every woman in this group, please, you have to say this to yourself every day. Every day. And as you are taking the information out there, you tell them to say this to themselves. Knowledge is my first medicine. Understanding is my first step to better health. When you have the knowledge, when you have good knowledge, there is nothing nobody can do to you. No, anybody cannot just treat you anyhow. There's no way anybody will do anything to you anyhow. There's no way. When you have the right knowledge, you will take the right steps and it's going to lead to better health. An informed mind is a powerful shield for a healthy life. Yes, it is very, very important. An informed mind. Because when you look at somebody that has the right information, for example, I cannot remember her name. She was talking about where she went to donate blood and they said, according to the test they had to run on the blood, it was showing that she had hepatitis B. Imagine that she was not very confident about herself and she did not know that she was not sure. Imagine that she was not sure about herself. She could have just gone and started taking treatment. And do you know what that treatment can do? Imagine you taking treatment for hepatitis B and you don't have hepatitis B. It can cause a lot. Because medications, the way they are programmed is either they will treat a disease or they might cause another disease. Imagine you taking something for something you don't have. It's going to bring another problem. So people have to have informed minds. Today, I commit to learning, questioning, and making choices that protect my health and my future. I wish everybody should be going home saying this. I think it's going to serve as a very great reminder that today you will commit yourself to learning, questioning, and making choices that will protect your health and your future. And as you are protecting your health and your future, you are protecting the future generation. I choose knowledge over ignorance, questions over silence, and informed decisions over blind choices. This is so clear. We have to choose knowledge over ignorance, questions over silence, and informed decisions over blind choices. Sometimes people will just shy away from asking questions. Sometimes you go to the hospital and you see, and they tell you something. They can just give you out information. And okay, for example, you go for ANC, your book, like for example, booking. You go for booking, and they will just tell you that you have to collect sample from your vagina, and you just climb. Sometimes it's always good to know why they are collecting it and what they want to do with the sample. It's very, very important. We have to put this at the back of our mind. My health is my responsibility. I will seek truth, understand my options, and choose wisely. Of course. I will not allow myths, fear, or misinformation to decide for me. I choose informed action. So living here today, in fact, there is a way that after praying in the morning, you say this to yourself as a woman before leaving the house. You will know when you will know what to do, when to do it, and how to do it. You will speak up for yourself. You will ask why anywhere and everywhere and to whoever. Next slide, please. Call to action. Knowledge is one of the most powerful tools for protecting your health. Yes, when you are knowledgeable, there is nothing that is going to be above you. When you are knowledgeable, you will ask questions. You ask why. When you are knowledgeable, you are going to help your next door neighbor. When you are knowledgeable, you are going to teach your children. When you are knowledgeable, you are going to transfer knowledge to your colleagues, to your friends, to your family members, and everybody. They say knowledge is power only when it is transferred. Now, at this point, you have received knowledge, and I am rest assured that you are going to take knowledge across the world. Wherever you are, you will take this knowledge there, and that will make knowledge very powerful. As a woman, we must seek reliable health information. Yes. To the right people. Don't ask anything from anybody in the cathedral. Just turn around and see somebody and you're asking, it's like this. It's like they will tell you their own experiences, and sometimes they will say it wrongly. So you ask reliable health information to the right people. You ask questions without fear. Fear sometimes will put us in trouble. Ask questions without fear. Understand our healthcare options. Yes. If there are always options, ask them, what if I take this one? Why should I not take but this one? When they explain to you, you as a knowledgeable individual, you will know that this one is good for me. I can go for this one because I will manage it. Make confident and informed decisions. As a woman, you're supposed to be very confident. Just for the fact that you're already a woman, it's supposed to make you very confident, because one woman is equal to a whole community. You cannot be a whole community and you're not confident in yourself. So all along, we have spoken about health rights. We have spoken about health, your informed actions and informed choices. So living here today, there are 3 things that you are supposed to move along with, and a lot has happened here. Thank you very much. I have come to the end of the presentation.
Thank you very much, Madam Ruth. Thank you very much for this incredible presentation and a very explicit representation. Madam Ayomide is back. I don't know if she could use 1 minute to add something, since due to technical issues, she could not finish her presentation. Madam Ayomide, please, do you have anything to add?
Okay, what I just wanted to add is that these 3 crucial topic that we have discussed this afternoon, I know there's a larger part to healthcare providers. I as an healthcare provider, I just want to tell everyone this afternoon, for any healthcare provider that might have offended you in the past, or maybe hurt you the way they talked and all that, I'm saying sorry on their behalf. And we should not use one person to judge the whole profession. There are still healthcare providers that are patient. There are still healthcare providers that they have listening skills. They are ready to hear you out. They are ready to journey with you if you understand your rights and you are open to them. So you don't make one experience or 2 experience to just decide that I don't even want to ask questions. Even when I ask, they don't answer me. If you continue like that, you begin to repress your right, and eventually you just live a life of not even ready to advocate for yourself. So I really want us to shift that mind. Whatever has happened with any healthcare provider in the past, moving forward, understand that there are other healthcare providers that understand all these ethics. There are other healthcare providers that knows how to attend to patients. Then another thing is that if we are seeking care, please, let's seek it in a standard place. I'm emphasizing this because I've seen a lot of deaths. I've seen a lot of morbidities due to women and even men now seeking care in a place that is not standard. Imagine a woman going for a cesarean section, and in that hospital is not a standard hospital. They just sutured uterus anyhow, and she came down with infection. From infection, she came down with secondary infertility, and a lot of things is happening to women out there. So please, for every lady, for every woman, for every mother, let's ensure that we seek care in a standard place, a place that they have skilled workers, they have competent workers, they have workers that they are not after the money, but they are after your health. Because I tell you, there are some hospitals out there that they see profit over lives. And I'm not saying it to just make you be afraid. I'm not saying it to maybe condemn any hospital or anything, but I'm just saying it for us to know the reality of what is happening out there. So please ensure that you seek care in a standard place. Then another thing is that Ms. Ruth also emphasized on, okay, seek reliable information. There are some people, they will tell you this is what to do. And what they are telling you is not verified, it's not scientific. And they themselves might not have even tried it before. So by the time you try it and it end up in a bad, bad occurrence, bad effect on your health, they begin to even blame you that when I told you, why didn't you seek further care? Because I've seen case whereby a mother-in-law told a woman to refuse treatment in a standard place, and eventually where she went to, they told her that there's a woman somewhere that can help her with delivery and all that. Eventually they fractured her hip when she was delivering because they don't have the right facility to take the delivery. They don't even have the standard syrup, the standard delivery couch. So there was pressure on her hip, and eventually the bone was fractured. If I begin to say stories, we are not going to live here. But the whole point is that, please, let's take our health as the most priority. And also, as a woman, as a lady, also have your own source of income, even if it is little. Because when it comes to accessing healthcare services, you need money. You need to be financially stable to an extent to access some treatment options. It's not only when you are sick. Of course, if you are pregnant, it's a good thing. It's a thing of joy. But for women that don't have enough finance to seek care on time or pay attention to their health or even eat good food during that journey, we lose some of them to anemia complications. We lose some of them to other things. So please, as a woman here, everything we have learned, act on it, practice it. Secondly, seek care in a standard place. Thirdly, be financially stable. Thank you.
All right. Thank you so much, Miss Ayomide. Thank you for laying more emphasis on the presentation. I think all of us are going home with one or two things. We should seek care in a more reliable health facility. And because one health practitioner did something wrong or spoke to you rudely, you shouldn't just be judgmental and put all the blame on every health practitioner. Thank you so much. So the next thing on the program, we're going to have a panel discussion, questions and answers. Though we started that already. So if there are other participants who have more questions, please feel free to bring it up now. You can put it at the comment section or you unmute your mic and you ask your question to any. Your question could be directed to any of the speakers, either speaker 1, speaker 2, or speaker 3, or generally. And for anyone who can answer, please feel free to answer the questions. Thank you. The floor is ours. If you have any question, please feel free to ask.
All right. So there was this question which came in. I'm trying to find it because it might have gotten lost in the chat. I'm just going to find it and read the question. Okay, so here's the question. Please, I wish to ask what someone should do if they are dealing with difficult medical personnel. For instance, if you are asking questions and a doctor is not answering, hearing your private information being discussed / gossiped about with other staff, or if the provider is very rude or intimidating and you feel uncomfortable to ask questions and all. I guess she's asking what to do in this case. Did we get the question?
Yes.
Okay. Any of the speakers can answer, please. Or
Okay.
anybody who wants to.
Okay. I think I got the question. The woman is saying that what she can do when our care or our condition is being discussed among the healthcare providers, and whenever she asks questions, they are not answering her question. So I'll start from the question part. I would say that for some healthcare providers, they are not just the teaching type. They are not just, and it's just that some people just don't want to learn, or some people are not just patient to interact with all patients. So for any doctor that doesn't answer your questions, so far that I know, for every healthcare facility, we have doctors, we have nurses. If you see any of the nurse that you find approachable and you know that she's ready to listen, you can keep your question, then ask the other healthcare provider. healthcare personnel. So even if it's not a doctor, for nurses, I would tell someone, even if I'm not a medical doctor, I read as if I am a doctor. I build myself as if I am a doctor, so that when my patients have questions, when I'm in between my patients and intervention, I will not be waiting for a doctor to attend to it. So even if the doctor doesn't answer your question, ask another person. Then another thing is that know when to ask question. Now I'm trying to say, if it is not doing consultation, sometimes, let me just cite an example. I am attending to 10 patients now, and I had an emergency during 2 a.m. So a patient was asking me questions. I've answered 3 out of 5 questions. So I had to tell the patient that, please, can you just keep your questions? I have an emergency now. The patient is on oxygen and I need to attend to the patient. So I left the patient room, went to attend to the emergency. Then the following day, I came back to answer the question. So also just know when to ask the question. That also matters. When you see that the world is busy, everybody's running up and down, might not be a good time to ask question. But when everyone is calm and they are settled, no emergencies, you can bring your question up again. But if you observe that kind of healthcare facility, doctors or nurses or scientists, they keep repeating, they don't want to answer your questions, you can change healthcare facility. It's your money you are paying for the care. You can change if you see that they are consistent at not giving you accurate information or giving you understanding of what they are doing for you. You can change your healthcare facility. Now, the second part, for doctors discussing patient conditions, when I mentioned ethics in that slide, some people just don't practice the ethical principles we are being trained in medical school. Because for every nurse, for every doctor, we have been trained on how to handle patient conditions, and that's the part of confidentiality. I shouldn't be telling another personnel about my patient condition if that person is not in the managing team and if there's no need to raise that condition. I go as far as when I want to attend to a patient and I'm exposing all her body, maybe I want to clean up for her, I lock the door. I tell every male to excuse, even if you are the brother, except her husband, or if she's comfortable with the person staying back. So it also depends on the professionalism level of those healthcare providers. Ideally, a doctor, a nurse should not be gossiping about a patient condition. If it's not that we are doing word round, or we are discussing with you, or we are trying to check up something with the other managing team, we have no need to discuss it outside the care of management. And if you see that they still do not stop after you tell them, oh, I'm not comfortable with this, I do not like it, I really value my privacy, and I want you to keep my information confidential, and they still do not answer you, I tell you, change the facility. Thank you.
All right, thank you so much, Miss Ayomide, for the response. I don't know, Miss
Can I
Remedy,
add
I
something
think
else?
she's the one who
Okay.
the good. Yes, sure, you can go ahead.
Okay, thank you.
Please, you just have for
Don't worry, I'm not even taking too long. I just want to inform regarding that question. That is why we said know your right. If you know your rights, you know that one of your rights as a patient is to ask questions and receive answers. When you know your right, and maybe the doctor has forgotten about the rights of patients, you can also educate them. Oh, doctor, like if they refuse to answer, you can ask them, doctor, do you know that it's my right to know? Like when they know that you know what you're talking about, there's no way they'll leave you to go without giving you an answer or giving you a reasonable giving you a reason of not answering you. Then for breach of confidentiality is also your right. You have the right to confidentiality, right to privacy of your information. So when you notice that they are doing like they're handling your information anyhow, you can, when you educate them, not that they become afraid of you, but they will know that yes, so this woman is not someone we can, I don't know if people know about medical legal issues. Most people will be afraid of getting into like medical legal issues when they do things that they're not supposed to do. So when you know your rights, how like the first speaker mentioned, when you know that you have the right to privacy, you know that you have the right to ask and get information about your diagnosis or about your treatment or anything, and you insist on it, there's no way they will allow you go without responding to you. Thank you very much.
all right, thank you so much, Miss Sarah, for that. And Miss Hermes, I guess your question has been answered. Yes, you have every right to get a medical legal document to sue the health personnel who disclose your information. If he disclosed your information without your consent, that's why we have the ethical in Miss Ayomi this presentation. We spoke about autonomy and other ethical things. So you have every right to sue the person if they didn't seek your consent in sharing your information. That's why we talk about confidentiality. You ask if you're like in cases of rape, working with survivors of sexual violence, you have to ask the person, now I'm going to be sending you to the lab. Do you feel comfortable with me taking you to the social worker, to this person, to this person, to this person, or do you want me to bring the person in here? So we should always know our rights, like what Miss Sarah said. So without any other waste of time, if there are other questions, please just feel free to ask so we round up quickly. All right, if there's none, silence means there's none. Please, can I get the outline for the program? I don't know if it's possible. Let's see the next thing we're supposed to be doing now. All right. If there are no further questions, or let's get to an audience reflection. And then we have the key takeaway homes. I think with this is just a refreshment. And let's see who hasn't said a word in this conversation. I don't know if Gloria is around, Miss Gloria. Then there's another Ruth. Please, can you give us your take-home messages? Can you unmute your mic and speak? And then we have Chick. Please, can you unmute your mic and share with us what you've picked from this session? Can you hear me?
Hello.
Yes, we can hear you.
My own take-home message is protecting myself and my health is protecting myself for my future and my family. And the one that touched me most is knowledge is power when it is being transferable. Knowledge is not where you have it and you just keep it for yourself, using it for yourself, but it should be transferable. Even if you can't say it by words with the excuse of being shy, let your actions portray it. And in case of any explanations from your actions, transfer the knowledge. Thank you.
All right, thank you so much. Okay, I guess on your screen you can see get involved with team. That's the inform models. There's a barcode. You can scan it for those who are joining and those who are not in the platform. And then you can also follow team on Instagram with the handle the inform models, on Facebook the inform models, and then there's a WhatsApp channel where you have to scan the QR code to see to get into the channel. So please, if you haven't done that, you could just do a screenshot to make sure you get the names on the different social media platforms. And lastly, I think we can call this a day, but before then, we are going to call on our mama, the main host, the person who has hosted this meeting, the brain behind this meeting, to give us a closing remark so we can call it a day. Please, Ma'am Success, the floor is yours.
Wow, what a wonderful session we have had. Oh my God. I just want to extend a huge thank you to all our speakers and to our MCs as well. Yeah, there's been such an exceptional session. And trust me, if I was not here today, I'll surely regret it for real. So I want to thank everyone present here today for taking out this time. You could be anywhere, maybe enjoying dancing, eating fish or whatever, but you're here with us today, and it means a lot. So as we come to the end of this conversation, I want us to leave with one important thought. I want us to understand that change does not always begin in big rooms or with powerful institutions. Sometimes change begins with a single woman who finally understands her rights. Sometimes change can begin just with a single woman who has finally understood her rights. A woman who now knows she can ask questions. A woman who now knows she can demand respectful care. And a woman who knows that her voice matters. Because when a woman becomes informed, she becomes confident. And when she becomes confident, she begins to advocate for herself. And when women begin to advocate for themselves, systems have to listen. Systems have to listen. Because many systems today, they have understood that women don't use their voices. Women are scared to use their voices, especially in healthcare settings. That's why I see systems are always working against women. But imagine a world where every woman stands up for themselves and says, no. You go to the hospital, your doctor is trying to tell you something. You say, no, this is how I'm feeling. This is what I want. Imagine a world like that. It will be powerful, right? And as one of our speakers mentioned, an empowered woman, she mentioned that, I think she said a woman is equal to a community, which is very true. Which is very, very true. Because a woman is like an umbrella. A woman is like an umbrella which covers everyone around her. So imagine that every woman is informed and empowered. Every woman finds their voices, can speak up confidently. Then trust me, the world will surely be a better place. So that is the power of information. That's the power of information. And that is the heart of the inform others. All what we do, this is exactly why we do it for. To see just one more woman who understands her rights. Just one woman who understands her choices a little bit more. It must not be big changes, just the little changes. That's what we live for. And our mission is simple, to ensure that women are no longer navigating their health journeys in silence, in confusion or fear, but with knowledge, confidence, and dignity. That's the heart of our work at the Inform Mothers. We work every day to see that we bridge those knowledge gaps. So as you leave this space today, I want to encourage you to carry one thing with you. Do not keep information you have gained here to yourself. Because if you attend this webinar, you have dedicated almost 2 hours of your time to attend this webinar, and then you go out there and keep everything to yourself. So what change are we doing now? Like the saying goes, be the change you want to see. So as you live here today, share everything you've learned with those around you, with the women in your life, even with the men in your life. They can pass on the information to other women that are around them. So share everything. Share with your friends, your colleagues, your sisters. As you begin a new week, you go about your day, you go to school, you go to work. You can just corner your neighbor and tell her that over the weekend you attended a webinar on International Women's Day. You know, they call it gisting, right? When you're gisting with your friend, what do you talk about? You can use this as one of your topics of discussion this week, okay? Because every informed woman has the power to inform another woman. And when women begin to inform each other, something powerful happens. When women begin to inform each other, something powerful happens. And what happens? Communities change, healthcare improves, systems obey, and dignity becomes the standard, not the exception. So I want everyone present here now to leave this webinar with this in mind. Live here more empowered, more confident, more informed, and pass on the information to other women that you care about. Thank you very much for being part of this discussion, and thank you for choosing to be informed. We are so happy to have you today, and we celebrate you every day. And we'll continue working tirelessly to see that every woman, every girl, everybody is informed and taking charge of their health journeys. Because we don't want a case where a woman will go to the hospital and just accept anything that's being done on her. And at the end of the day, she's grumbling, she's angry that the hospital is not treating well or whatnot. No, we don't want that. That's why we do what we do. And we don't work just with women, we work with women at all life stages, from girlhood to motherhood and beyond. You can see our tagline there. So follow us on all social media platforms. We have a lot in store, and we have a project we are currently running now, which I think will be very beneficial to you. So as you go back to your little corners, tell one person about it, inform others, and let us grow together. Thank you so much, and have a wonderful day. Happy International Women's Day.
Thank you so much. Wow, thank you so much, and happy International Women's Day to you too. So we've heard from our host, and we are promising her that we are not just going to take this information and sit with it. We're going to share it. And she says change doesn't just start in the conference rooms. It starts from one person, and that one person, it's you. That one person, it's me. Thank you so much for being patient, and have a nice day. Enjoy the rest of your evening. We can unmute our mics and turn on our videos so that we see ourselves.
Yes, exactly what I wanted to
Yes, ma'am,
say.
you say something.
Yeah, I just wanted to see with us to unmute our mics and videos so that we can take some screenshots if it's not too much problem. Hello.
Hello. Good
Hi.
evening, everyone.
Hi, everybody.
And thank you for the person that presented when my phone was off. Thank you so much.
Yes, I am here. Thank you too.
You did such a great job. Thank you very much for stepping in.
If she prepared for it.
Yeah, meanwhile, she was not prepared. That's how we roll. Thank you guys so much.
Thank you.
Do some little pause. Let's take a screenshot.
Okay.
Let me take my start.
Take your individual screenshot. I want to see it on social media.
So I think some people with Gloria.
Snap me. Mask.
Please, if you can unmute your video, please do so. But if you cannot, it's fine. What we have. Okay. Everybody say cheese. Woman, eh.
Hey.
I'm happy that our Nigerian sisters are answering to the phrase. That's good. Okay. Thank you and enjoy the rest of your day.
Thank you so much. Bye.
Bye-bye.
Bye.